Hi, my name is Dr. Catherine Sims. I'm an adult rheumatologist at Duke University, and today we're going to review the Vasculitis Foundation's Reproductive Discussion Guide for Men and Women with Vasculitis. This handout covers topics including pregnancy planning, birth control, and infertility. It is meant to serve as a conversation guide between patients and providers. Please ensure to discuss with a medical professional before making medical decisions. This is an overview of the handout, and as you can see, it covers a lot of information. We will be reviewing each section in detail and further discussing the important aspects of vasculitis that should be addressed prior to pregnancy. If possible, start your discussions about pregnancy with your physician at least 6 months to a year prior to conception, as this allows for time to ensure all your medications are pregnancy and breastfeeding compatible. You and your physician will plan to stop pregnancy incompatible medications and start pregnancy compatible medications. This may be done slowly to prevent flares or symptoms of active vasculitis. Prednisone is relatively safe in pregnancy, but if you are requiring 10 milligrams or more per day, your doctor may want to start additional medications to decrease that dose. The strongly recommended medications are pregnancy and breastfeeding compatible. Doctors use prednisone to control inflammation, but our goal is to control your disease with other medications on this list. The conditionally recommended medications are generally pregnancy compatible, but need to be discussed with your doctor, as special timing or monitoring may be required. You will see the generic names listed alongside their trade name in parentheses. Cyclosporin and tacrolimus require a monitoring of blood pressure during pregnancy. The class of medications known as NSAIDs, or nonsteroidal anti-inflammatory drugs, can be used during the first trimester, but should be discontinued in the second and third trimesters. Rituximab can be used when there is threat of life or organ damage from active vasculitis. TNF inhibitors, which is the list of medications starting with infliximab, can be continued throughout most of pregnancy, but may be discontinued about 4 to 6 weeks prior to delivery to decrease exposure to the child during delivery. The medications that fall under the category of insufficient information are traditionally newer medications that lack safety data in pregnancy and breastfeeding. Newly developed medications would likely fall under this category. Ideally, patients would be switched to medications in the strongly and conditionally recommended categories. Have a discussion with your doctor prior to becoming pregnant while taking these medications, given the unknown impact on your pregnancy. These medications are incompatible with pregnancy because they are associated with birth defects and pregnancy loss. If you are taking cyclophosphamide, methotrexate, or mycophenolate, you should stop this medication immediately and call your doctor if you become pregnant. If you are interested in pregnancy, have a discussion with your physician about alternative medication options. If you are currently pregnant and have a history of vasculitis, please register for the Vasculitis Pregnancy Registry or VPREG database using this URL or QR code. We are interested in hearing your experiences regarding birth control, conception, pregnancy, birth, and breastfeeding. Your experience and participation will help other women with vasculitis have safer pregnancies. For additional resources, please visit the following websites. Bedsider.org provides additional information regarding birth control options. ACOG.org/patients, created by the American College of Obstetrics and Gynecology, has several resources discussing birth control, conception, pregnancy, and breastfeeding.